Hello, I'm Brent Majors. I'm the Executive Associate Dean of the School of Medicine and the Chief Executive Officer of Texas Tech Physicians. It's my privilege to speak to you this morning. We normally do it in person, but as you know, we're not doing it that way today. But I want to welcome you, and I hope to get to meet you over time in the years that you're with us. Some of you we know because you attended Texas Tech University Health Science Center School of Medicine, and some of you are new, but we want to welcome everyone. We want to make this the best possible experience that we can for you. My job is to be in charge of the practice plan, the physician practice plan. To the public, we market it as Texas Tech Physicians. You may also hear it referred to as MPIP, Medical Practice Income Plan. Just like every other school in the United States, Texas Tech Physicians needs a practice plan to carry out our mission because of the following reasons. One, it helps us with learning opportunities for residents and medical students and fellows and other people. It provides a laboratory, a place to learn, to interact with patients. Two, it provides a place to do research, clinical type research, not the bench research, but clinical research. And third, it brings in several $1 million a year in patient fees. We accept most major insurance policies. We accept Medicare and Medicaid, and we try to operate our practice where it attracts patients that will want to come to us and receive a high level of care and also have a good experience. I want to talk to you for a moment about the GEARS poster. I believe it's in the notebook that you've been provided. If you would turn to that page, that might make it easy to follow along. This is the ideals, I-D-E-A-L-S, related to Texas Tech Physicians. This is what we aspire to be. This is our lofty goals, you might say. And so it begins with the gear in the upper left corner, and it's our vision. Our vision is to be a top-tier medical practice known for our excellence in quality, patient care, satisfaction, and value. And I'm sure you're familiar with the concept called the triple aim, which is excellent care at a fair price with a good patient experience. And that's what we're about here. And we came up with this about 14 years ago, and I believe it stood the test of time quite nicely. We recognize that it's pretty much the basics, but let's give our patients excellent medical care. Let's do it at a fair price, and let's have a good experience where they perceive value. They are satisfied with the experience. So that's our vision, and we're well on our way. I'll talk about some of these metrics here in just a moment, but we've made great strides over the past several years, and we look forward to your association with us and going even further. Right in the middle is the yellow gear, and it has our mission on it for Texas Tech Physicians, and that is to improve the health of people we serve with a spirit of compassion and knowledge. Those words were carefully and deliberately chosen. It takes both, right? It takes compassion and it takes knowledge. We can have a lot of compassion and not knowledge. That doesn't work. We can have a lot of knowledge and not show compassion to our patients, and that doesn't work. So you see why I'm calling these ideals. This would be the ideal situation where a person had an excellent balance, tremendous clinical knowledge and expertise, but also the right amount of empathy and concern for our patients. So we want our patients to enjoy the highest level of health that they can possibly enjoy, whatever their health status might be. Then we have key performance indicators, and those would be the blue gears. And we chose the gears motif, by the way, to indicate that everything works together. So when all these gears are turning, then we will get to our vision. But like most companies these days and schools, we're into measurement, and we have key performance indicators. So we quantify everything that we possibly can to measure our progress and see how we're doing relative to our plan and what it is we're wanting to accomplish. I've been greatly influenced by a book called The Balanced Scorecard. It was written several years ago by two Harvard business professors. And in it, they talk about how American businesses should focus on more than just the bottom line. What happens if we focus just on the bottom line and ignore our employees, ignore the quality of our product, ignore our patients? Well, that's a recipe for disaster. And so the two professors who wrote this book said you need a balanced scorecard. You need to have several things that you're watching and orchestrated and synthesized, then that will allow you to accomplish your overarching objectives. And so these aren't in order of importance, but they're all important. The first one happens to be the first one, is on the patient experience, or we call it patient satisfaction also. Those are interchangeable. But we use Press Ganey to measure our patient satisfaction. And here we're looking at how does the patient perceive the experience? Were they kept waiting? Were they put on the phone on hold when they called? Were they able to get through promptly? When they arrived, were they kept waiting? A lot of it centers on wait. Having people wait is always to be avoided. Were the people at the front desk friendly? Did they welcome them? Did we try to minimize the paperwork, all the consents and things that we need to obtain, as well as insurance coverage? A lot of that can be done before the patient arrives and make it a positive experience. And then when they're taken back into the exam room, people in nursing service, were they cordial, professional? And then the physician, other providers, how did they treat? Were they good at listening? We have a course that you're going to hear about, the American Academy on Communications. We've designed, or we've purchased and have worked with some professionals to offer this course. And so we can enhance communication with our patients. So very vital. And so we get a scorecard, we get a report on how we're doing on the patient experience. We only use it to help people improve. We don't use it to embarrass anyone or cause anyone discomfort. It's to see what we can do to improve. Maybe we're not answering the phone timely enough. Maybe we're not answering the patient's questions. Maybe it's taking too long to get an appointment. It could be a myriad of things. We've had parking issues here in the past. I think we've got enough parking now, but it could be almost anything. The next is quality medical care. And on this one, we use a lot of the HEDIS indicators, which are guidelines that have been set up, standardized by quality agencies in the United States. And this has to do with things like getting a mammogram, getting a colonoscopy, A1C, keeping your blood hemoglobin under control, hypertension. We have a number of these quality markers that we measure for our patients as we focus on outcomes. And many of our contracts are now tied to achieving certain levels of compliance on these different health measures. The next one is business growth. That has to do with being really competitive in the marketplace. We want people to come here. Yes, we have other providers in town and we work with many of them, and many of them are our graduates, but we want people to also come here and to know that they're welcome here. We have a place for them here, and we want our market share to grow. We tried to operate like a business, and we look at our payer mix. It takes all types of payers to make the enterprise thrive. We don't discriminate. We welcome everyone, those without insurance, but we also need some commercial insurance to make sure that we're covering all of our expenses and covering our overhead. So we don't discriminate. We welcome everyone, but we want to have a product that is competitive for people who have a choice, and they will select us. Employee satisfaction is pretty self-explanatory, but we want to provide our employees with an opportunity to grow, to be competent in what they're doing, and to have a friendly, cordial, professional work environment. At our school, we have values, which happen to be in my office at this time, but our values are to work as a one team, to be kind-hearted, integrity, visionary, beyond service. All these are important to us, and they're contained in the green gear that follows the next one, which is financial performance. And what can we do on financial performance? What can you do as a new resident to help us achieve our financial goals? Well, a lot of the documentation will fall on your shoulders. And as you work with your attendings, you'll find that you do a lot of the documentation always overseen by an attending, but it's important to learn documentation and what the necessary elements are to have a complete chart. We use Cerner. It's our electronic health record. The timeliness of documentation is very critical. Working with coders in your department, working with your, as I say, your attending. And there's many ways that we can document to assure accuracy. And I can't bear down too hard on that point. We're trying to make it as accurate as possible. I'm talking about the medical record, not to embellish it, not to upcode, but to make it accurate and reflection of the patient's health status and what was done for the patient and the patient's plan and their medication list and their history of present illness or chief complaint, the problem list, all these things that have to be documented in the electronic health record. So I think that's about all the time I have here today, but I do want to thank you very sincerely. And if you see me in the hall, I guess we don't shake hands anymore, but you can at least wave, and I'd like to make your acquaintance and get to know you in the time that you're with us. If you have any questions, I'm easy to get a hold of. Drop me an email, come by my office, give me a call. Number and email address are easy to find. Jay Bates certainly has them. But welcome to Texas Tech Physicians, and I hope you have a wonderful experience here. Thank you.